an overwhelming response to this topic. So I'm excited to talk to you a little bit about state of the market. We're going to begin the presentation today by talking a little bit about what's going on with healthcare reform. So with that, we're going to jump right into it. You know, the vote on healthcare reform had to be filed this morning, I think by 11 o'clock, in order for them to bring it to the floor for a vote before they leave on Thursday. Congress leaves tomorrow for a week, and so clearly there's not going to be a vote in the near future. It looks like with 22 absolutely no votes, they're shy of the 60 they need to get the thing passed through reconciliation, which is a different form of processing a change to the law than going for the full repeal and replace process. There's a lot of things that have come out in the last week on how they're changing things to garner some conservative, conservative Republicans consensus and get them to vote yes on repealing and replacing Obamacare. I think the difficulty that we have is they've added this week a new pre-existing condition way for the states to file a petition to allow some of the insurers to charge more, as long as there's some ability to protect the sickest. This change really has a lot of us concerned. That and last week with the statement that they're repealing or removing the essential benefit clause. So there's a lot, that's going on with the healthcare change with the new administration that's concerning. Specifically, the fact that it's going to be age-banded subsidies or tax credits versus the subsidies that are in place today. So I know in my presentation in Baltimore, we talked a little bit about the way Obamacare works today. For somebody going onto the state exchange, they, based on their income, either qualify for a subsidy, which 80% of the people going on to the state exchanges as of 2017 qualify for some governmental assistance through that subsidy. And the way that the Trump administration has proposed their new healthcare reform bill, that will change to an age-banded credit, and it's going to be a tax credit, which some think, because there's not been a lot of explanation on how that's going to work, really think that the tax credit would occur, when you file your taxes the following year, you'd get that subsidy or tax credit, which that's why people, including a lot of the Republicans that are up for re-election, are concerned that millions of Americans will have to drop out because they just don't have the funds to cover that premium on a monthly basis without that subsidy taking place at the point of sale. So I've put together on this slide kind of, so a lot of employers say, healthcare reform really doesn't affect me because it's the state exchanges and the uninsured that are buying policies and other avenues other than employer-sponsored healthcare. But it really, some of the provisions will affect us. And one of the things that I've tried to do in this slide is kind of put together the things that will affect us if this does, go through and change the way that healthcare is, through the exchanges exists today. The pre-existing condition proposal, I am concerned on the cap on the income, tax exclusion for employer-offered benefits. That's something that we need to watch. We've talked about that at all of the conferences this year, and it is something that is concerning. One of the benefits with the new healthcare reform package is the incentives for expanding the HSAs with the consumer-directed health plans, which are very prevalent today. Of course, the excise tax is something we absolutely have to pay attention to. And that's really that single element in healthcare reform, whether it be Obamacare or Trumpcare, has been really driving our decisions in the past 3 years. And then, of course, the other two are a little bit less important to employers. But if you look at the bucket of money that's sitting out there that is available to the government that's not taxed today, it is compelling because it's bigger than mortgage deductions. It's bigger than the pension plans and the 401k contributions, all of those. So it is a significant amount of money that they could tap into, and they have talked about from time to time that's out there. So a lot of employers say to me, with healthcare reform and the changes and trying to keep up with everything that's going on in the media, really, what is it that we should be doing? And I think what you really need to be doing is taking a look at your strategy and really preparing as if, Obamacare stays or if it changes to Trump care. We really need to be blocking and tackling and really doing the same strategic things that we've been doing all along. And that's really looking at your benefits program, looking at your utilization, what's driving cost, what are the new things out in the market today that we should be thinking about. And I've, kind of outlined in the middle section here, looking at your philosophy and looking at trying to figure out what it is that you want to do with your strategy that will really get you to the next level. And the 3-year strategy, looking at things in multiple years increments instead of just 1 year at a time. But really, healthcare reform, the impact to us is that the uncertainty really makes it hard to plan, right? Because we don't know whether we're planning for that excise tax to take place in 2020 or whether if Trump does get his reform package passed, that changes to 2026 as it stands today in their current plan. Subject to change, of course, because things are fluid and changing daily on their platform and what they're proposing. But he's kicked the can down the street a little bit further for us, and his proposal is 2026. So I think what they've missed in healthcare reform, and really what we're going to talk a little bit about today, is the focus on significant efforts to change what the cost of healthcare is, and really focus on what's coming down the pike and what does our future look like with healthcare in general and what decisions are being made. And I will tell you that with 55 million millennials in the workforce today, I think they're going to be pushing us to think of things a little bit differently than the way that we've thought of things in the past. There's a really interesting article today that came out in eBen News. I don't know if anybody reads that, but it's talking about millennials' drive to push for data. So very much our topic today. This is really a slide that I use because I really like to talk about the decades and really our prevailing thought process by decades. So we all know that consumerism has been kind of the front runner in the answer to trying to curb cost and making people more accountable for how they spend the healthcare dollars. And really, the consumer-directed health plans, as you saw in the slide earlier, over 60% of employers offer consumer-directed health plans today with high deductibles and coupled typically with an HSA to have the employer cede some of that high deductible. And how many, over 30% of employers are using that as the only plan option versus their traditional PPO plan of the past. One of the interesting things is we're moving through that and kind of, the outcome of consumerism and people really all of a sudden at the doctor's office or at the pharmacy saying, that's a $300 prescription and now it's coming out of my HSA bank account because I, have a high deductible plan. And even though my employer cedes some of that HSA, it's my money. So if I don't use it, I get to bank it for future healthcare costs. And so when they go to the pharmacy and there's a $300 prescription, for the first time ever, people are saying, is there a generic alternative or a less expensive option to that? That's definitely helped us a lot in kind of looking at the lowest increase in 2 decades. Has a lot to do with the consumerism element to the plans that are in place today as the prevailing plans. And I think what you're going to see is in the next couple of years, you're going to see a push into the value-based plan designs. And these are high efficiency networks, higher quality networks, centers of excellence, things where we're actually seeing employers for the first time saying to their carriers, I don't want every doctor in the book. I want the best doctors in the network. I want the doctors with low complication rates and what who does what the best with the best success rate. So for the next, and you're going to have to forgive me, I know I sound like I have a cold, but it's allergies because here in Pennsylvania, everything blossomed at the same time. But now we're going to get into the fun part. So we've kind of covered the overview of healthcare reform or the lack thereof. And we're going to push into kind of what's new, what's happening. So I had mentioned earlier, the 55 million millennials who are in the workplace today and the generation coming up behind them are definitely going to want to access healthcare differently than we did, and certainly differently than the way that our parents did. I look at my aging parents, and I think my parents would never second guess a doctor or ask a question or seek a second opinion. And that is not the way that the millennials view healthcare, especially with the bank account approach, with a high deductible plan, with an HSA. They really believe that that's their money, and they want to be competent in the decisions that they're making on how to spend that money, which is definitely going to help us as employers if we run along that same path with them with providing data. So it's an opportunity for us, really, if you think about it. I had the opportunity to hear the COO of IBM Watson speak 3 weeks ago. And she was probably the most dynamic speaker that I had heard in a very, very long time. And what she was saying was very compelling and very exciting. And I think it is kind of the way that our future generations are going to want to access healthcare and how it's going to change the quality of healthcare. I think in the next 12 to 36 months, you're going to see pretty significant changes in the way that people want data. They want information on quality providers and such. And she shared a very personal, compelling story with us that she was diagnosed with breast cancer, and she was incredibly engaging. And she said, I know people. I know the best physicians probably in the world, if not the U.S. And she said, I sought care from probably 3 different oncologists that were foremost in their world, right, on expertise. And she said, I got 3 completely different diagnoses. And she was stunned that she got 3 different opinions, and all the opinions were vastly different. So the first doctor that she went to said she had stage 1 breast cancer, which equates to having a lumpectomy. The second physician said she was stage 3. And the third physician said she was stage 4, which meant a radical mastectomy. So she came away with feeling very scared and really just startled at the different diagnoses that she got from the various providers. And she sat back and she said, what is the right answer? It can't be stage 1 if it's stage 4. And vice versa. And how do you as an individual seek a treatment path when you have such a varying diagnoses? So she went back to Watson, which is IBM's cognitive computer that many of you saw years ago, 3 or 4 years ago, maybe even 5 years ago at this point, who played Jeopardy, and he always won. They refer to him as a he. And her comment was, just in oncology, there's over 8,000 periodicals and research papers printed every single day, and it is impossible for an oncologist to treat patients and keep up with what's going on in their particular field as far as advancements in research, advancements in treatments, and really what's the prevailing thought on the current medications that are out on the market that are being used for oncology. And there are that particular area of pharmaceuticals is advancing very quickly. As you can all see by looking at your utilization reports, oncology is either number 1 or number 2 on your list of pharmaceutical medications. They're very expensive. They're typically specialty drugs at this point, and they're injectables. So they're always very, very expensive. And so she said, Watson, we can push Watson all this data and all of these research papers. They taught him to read, basically. It's a cognitive, thought-provoking idea of how a computer can digest all of that information and use it to make very good decisions. They've now coupled, in the last 12 months, they've partnered with Quest Diagnostics, who is providing Watson with the clinical data, the genomic testing, the clinical data from each person that they're looking at. And they've partnered with other firms like Best Doctors, who is a second opinion kind of teledoc system that employers have access to purchase their services. And when you couple all of these people together, the goal and objective, she said, is in the next 12 months to empower some of the leading healthcare organizations that are providing healthcare in the country to use this system to help their physicians with making diagnoses and better paths of treatment. So they're also cooperating with MD Anderson and Sloan Kettering and some of the top organizations in the country on specifically oncology right now. That's what they're focused on, and trying to get this technology in the hands of providers so that we're not expecting people to keep up with, physicians and hospitals to keep up with who's doing what with the best success rate. And certainly when there's an amazing breakthrough or research that is compelling that might be used to change a path of treatment, that it's available to the physicians and the doctors. And I think what we're seeing on the consumer side and the employer side is using some of this new technology. And I just use IBM Watson as an example. There's many, many different tools out there today, like IBM Watson, that they're emerging. I mean, there's innovative companies that are coming out every single day in the healthcare marketplace to empower us with more data, more decision support tools, and quite frankly, making it easier to seek better quality of care at a lower cost than ever before. So, the consumer, whether you like consumer-directed health plans, the high deductible plans or not, and I know I fielded a lot of questions when we were at the Baltimore conference from employers concerned that people may not seek care if they have a high deductible plan where they have a high portion of the deductible before they have coverage. And I will tell you that data so far, in the last 5 to 8 years of existence has not shown that people are avoiding care, but it has shown specifically that people are using care more wisely, that they're asking more questions, that they're seeking second opinions, and they want to have more data before they decide their path of treatment, and they're taking more ownership. And there's nothing more exciting than that in our world, because as the payers, employers for a very, very long time have been managing this pretty much solo, right? You've been trying to manage your 20% trend or your 15% trend down to 5 or 6, which has been the norm for years, and trying to figure out how this expense that's second to payroll, how you wrap your arms around it and strategize with it. So I encourage you to really take a look at your strategies. Don't get distracted by healthcare reform and whether Trump gets his bill passed or whether Obamacare stays in place. Which if Obamacare stays in place, I have to be frank that I don't think it's going to be viable for very much longer, just because there's very few options in many of the states where they have the inability to make a significant profit as health insurers, which they're wanting to actually make a profit on these exchanges, which is hard because it is bad risk. So that last slide was really just kind of trending thoughts and trending strategies for you to think about. We talked a lot about these in the different sessions. And I love these little power lunches to kind of tell you little stories about what's going on in the industry. And we will keep doing these the first Wednesday of every month. So grab a sandwich and then join us for these updates. And if you have any questions, Kelly, I think you said that you were going to open up the dialogue box for any questions. And I'd certainly be willing to stay on for those of you who can stay on for a little bit and answer some of the questions that you may have garnered.
Yep. Attendees can type their question in at the bottom in the Q&A pane. We have one question so far, Marybeth, and they're wondering if the slides for today's presentation are going to be made available.
Absolutely. They can be made available right after our session today. Kelly, you can post them on your website, and I will make sure that they're posted on my website, which is listed right on this last page.
Okay, great.
Great. Well, thank you so much for joining us, and I hope everybody has a productive rest of the week, and we will see you all back here on the first Wednesday of next month.
Yep, Wednesday, June 7th.
Perfect. Thanks, Kelly.
Thank you. Bye-bye.
Bye.